Hello, and welcome to part 1 of skull pathology. While CT and MRI are certainly more commonly used for brain and skull imaging, in this presentation we'll take a look at some plain skull radiographs to help identify some of the more common skull pathologies you may see. In the examples on the screen here, both of these patients have intracranial bleeds or hemorrhages. You can see the example on the left. This is a head CT, and this white area is all blood. And the example on the right is an MRI of the brain. And again, this white area represents blood. So this could be caused by a stroke, it could be caused by trauma. We really don't have enough information here. But let's take a look at some other common skull pathologies. First, skull fractures. So there are several types of skull fractures to be familiar with. The first is called a linear skull fracture. A linear skull fracture is a fracture of the skull that may appear as a jagged or irregular lucent line. And you can see that right here. So this lucent line represents a skull fracture or a break in the cranial bone. Next, we have a depressed skull fracture. And a depressed skull fracture occurs when a fragment of bone has been separated and depressed into the cranial cavity. And that is what you see here. Sometimes these depressed skull fractures are called ping pong fractures. Next, we have a basal fracture. A basal skull fracture is a fracture that occurs through the dense inner structures of the temporal bone. And these fractures are very difficult to visualize because of the complexity of the anatomy in the area. So think about the dense petrous pyramid region. There's a lot of minute structures there, and so catching or visualizing a basal skull fracture can be difficult. If bleeding occurs, plain radiographic images may reveal an air fluid level in the sphenoid sinus if you used a horizontal X-ray beam. So a little bit more about basal skull fractures, because these are pretty interesting. In a basal skull fracture, you may have cerebrospinal fluid leaking through the ear or the nose, and you can see that here. There's some cerebrospinal fluid and some blood. The patient may have bruising around their eyes, which is referred to as raccoon eyes, and there may be bruising behind the ears. And remember, basal skull fractures involve the floor of the skull and the dense temporal bone. Again, if you used a lateral X-ray beam, you could notice air fluid levels in that sphenoid sinus. And here on the CT scan, you can see there is a break or a fracture in the temporal bone here and here. Next, we can certainly use X-ray to help identify cause of death in post-mortem autopsies. So in this case, of course, the patient has a large blade in their cranium. This would be a lateral view of the skull. Remember, it would be very important to also obtain an AP or a 90-degree view as well. Let's talk a little bit about skull neoplasms. Remember, neoplasms are new and abnormal growths, and metastasis are malignant neoplasms that have spread to distant parts of the body through the blood or the lymphatic system. The skull is a common site of metastatic lesions, and remember, lesions can be osteolytic or osteoblastic. Osteolytic lesions, of course, are destructive and often have irregular margins, and that's what you see on this lateral skull radiograph. These lesions are osteolytic. They're taking away from the bone density. Osteoblastic lesions are lesions with increased density, and we'll look at examples of that here in a little bit. Interestingly, you can have a lesion that is a combination of osteolytic and osteoblastic. So let's look at some other examples of neoplasms. So multiple myeloma. Multiple myeloma tumors originate in the bone marrow, and the skull is a commonly affected site. This skull radiograph demonstrates multiple radiolucent lesions, and you can see them scattered throughout the skull. Multiple myeloma is a primary bone malignancy, and unfortunately, the median survival rate is only about 3 years. Okay, next, Paget's disease. Paget's disease is another example of a neoplasm, and Paget's disease is described as osteoblastic. And let's talk more about that. Osteoblastic lesions, remember, are lesions of increased density. And in its late stages, Paget's disease is a great example of an osteoblastic neoplasm. But remember what Paget's disease is. In its early stages, it's destructive. So in Paget's disease, we have bony destruction followed by bony repair. You remember that? We've talked about this with other body parts. Paget's disease can involve many sites throughout the body, and radiographically, first you see areas of lucency. Remember that osteolytic or destructive bone lesion. And then when the body tries to repair itself, you'll see osteoblastic growth, or this cotton wool appearance. So the body is trying to repair itself, but then the lesions add density to the bone. This skull that you see here would be late stage Paget's disease, and this is the body's, again, reparative stage when it's trying to heal itself. Next, another neoplasm to be familiar with is a pituitary adenoma. This is a benign tumor of the pituitary gland, and usually we investigate these tumors using CT or MRI. However, plain radiographic images of the skull may demonstrate enlargement or distortion of the sella turcica and erosion of the dorsum sellae. So the image on the top here is an MRI of the brain. This is a sagittal slice of the brain, and you can see this large pituitary adenoma. And then here we see an axial or transverse slice, again, of the brain with this large pituitary adenoma. And while this is a benign condition, it's concerning because it certainly pushes on other structures around it. You can see it's getting awfully close to the optic nerve here. Here it's pushing on the ventricles of the brain. So certainly we would want to address this. So that brings me to this drawing in the bottom here. This is an endoscopic pituitary tumor operation, and they access the pituitary gland or tumor through the nose. So that is pretty cool. Okay, next, mastoiditis. Now, mastoiditis is not a neoplasm, it is actually an infection. So acute mastoiditis is a bacterial infection of the mastoid process, and remember that's part of the temporal bone, and mastoiditis can actually destroy the inner part of the mastoid process. The mastoid air cells, in this case, are completely replaced with fluid instead of being air-filled. And of course, that can lead to progressive hearing loss. A CT scan, as you can see on your screen here, demonstrates a fluid-filled abscess that has replaced the air-filled mastoid cells. So let's take a look at that. Notice when you compare this CT scan on the left to this CT scan on the right, notice the difference or the asymmetry. So this area here normally should be air-filled, and here it's just being replaced by more and more fluid. And that is part of that infectious disease process. You can also see externally, certainly this is concerning. It's red and swollen, so all signs of an infection. And you'd want to treat this quickly so that it doesn't cause any hearing loss. Okay, another example of a neoplasm is an acoustic neuroma. This is another example of a benign tumor. However, this is affecting the auditory nerve sheath that originates in the internal auditory canal. So we are talking about a neoplasm in the inner ear. Symptoms of the acoustic neuroma include hearing loss, dizziness, and loss of balance. And we know that our equilibrium and our hearing are really housed in that inner ear, so this makes sense. An acoustic neuroma is typically diagnosed with the use of CT or MRI, but sometimes we'll capture it on plain skull images, especially in advanced cases where there's been expansion and asymmetry of the affected internal acoustic canal. And you can see a really cool example here on this CT scan. So for acoustic neuroma, just know that it's a benign tumor of the inner ear. That's sufficient for our purposes. Next, we have a cholesteatoma. A cholesteatoma is another example of a neoplasm. It is a benign cyst-like mass or tumor that is most common in the middle ear or the mastoid region. And often the cholesteatomas are secondary to trauma. So maybe the patient had an injury to, in this case, the left side of their skull, and after that trauma, the cholesteatoma develops. A cholesteatoma will eventually destroy the bone and can lead to serious complications, including hearing loss. So again, while it's benign, it can certainly affect our hearing. And again, look at the asymmetry between the right and the left. You can see something abnormal on the left side. Wonderful. So we're going to pause part 1 here. We'll pick up part 2 talking about facial fractures.